Hello, my name is Vicki Tate and I just want to ask you a question. Have you ever had a motor vehicle accident or a nasty fall, horse fall, push bike, motorbike, and then ended up with a really sore and stiff neck and shoulders? If so, you may have received a whiplash injury. So I'm going to be talking about this today. My name is Vicki Tate and my business is called Body and Spine Align. I use a very gentle technique called orthobionomy and have found it extremely effective for whiplash. In fact, that was the injury that I had in my neck and shoulders, which debilitated me to the point where by the time I was 40 I couldn't work anymore. And this technique is the only thing that helped my neck and shoulders. So let's have a little chat about what whiplash is. It's very common, and it's actually more common than most people think, and it usually happens after a motor vehicle accident or a fall or injury. And how it happens is that the neck accelerates, or the head accelerates in one direction, decelerates very quickly, then accelerates and decelerates very quickly in the opposite direction. What tends to happen is that the two little bones at the bottom of the neck get stuck in taking the head back, and the two little bones at the top of the head get stuck with the head pushed down. So you end up with this abnormally shaped cervical spine, or the neck, and then that causes a lot of pain radiating out into the shoulders and the arms, headaches and fatigue and all sorts of other symptoms. It is estimated that in the United States, whiplash costs approximately $30 billion a year in sick pay and benefits. And there are probably a lot of people walking around with an old whiplash, a very small whiplash that they got when they were a child or a teenager, when their life was a little bit more hectic. And about 15 years later, are finding that they've got chronic headaches, neck pain, shoulder pain, symptoms in their hands, eye issues, tinnitus, all sorts of things. And often they can come all the way back to that very old, at minor whiplash at the time, but over time that chronic condition starts to cause issues in the soft tissues, and that's what we start to see. So as I mentioned, there's headaches, neck pain, neck stiffness, shoulder pain and stiffness, dizziness, fatigue, and brain fog, very common. Some people find their eyesight really is really is affected by whiplash, and weakness in their hands, ringing in the ears, and even back pain. So the back pain can be middle of the back, so like around the bra strap sort of area, but some people even experience pain right down into the pelvis, and it just depends on your particular symptoms. So how does it get diagnosed? Well, initially when you have your accident and front up at the emergency room, there'll be a set of x-rays taken. And sometimes it doesn't show up in the x-rays, and it might be some weeks, months later that you are experiencing difficulties in the soft tissues as they go into like a post-traumatic shock syndrome, where they're constantly trying to hold the neck in a position, and the slightest little bump or blip will cause the symptoms to come back. I know when I had my symptoms, if I lifted a shopping bag too quickly, or I missed a step going over a gutter, or tripped over the footpath where they have the little highs and lows in the cement, any minor trip or injury would cause my neck to be in such pain. I was seeking treatment every fortnight for 10 years. It still didn't prevent me from getting chronic injuries in both arms, which prevented me from working by the time I was 40, and I had my injuries when I was in my late teens. So they'll give you a little bit of an idea about how long-term the effects can be. I very often see people coming into my clinic complaining of neck pain or shoulder pain. When I ask them about accident injuries, they say, no, I haven't had anything significant. but when I feel their neck, I can feel the rigidity in the tissues, and also the fact that the bones are not sitting in their correct positions, and that they're very sensitive. So we start to work with that, and very soon their symptoms go away. The techniques are very, very gentle. So most people find that they'll say, oh my goodness, this is the first time I felt like my head doesn't weigh a ton, or oh my goodness, I feel so relaxed. What are you doing? And all I'm doing is taking the pressure off the muscles so that their head can rest, because their head is in a constant state. You know, you've got this big lump here, about 4 kilos of lump floating around on top of this bobblehead, and you've got a lot of muscles that attach all the way down into the pelvis to help support the neck and shoulders. These days we take x-rays pretty routinely of anyone who's been in a motor vehicle accident, of a significant velocity, and also MRI, and we can do functional MRI. So if there's residual issues in the soft tissues, functional MRI will often show up those difficulties in the soft tissues. So what I find with most whiplash is that they've been treated quite poorly, and there's very little effective research around to show what actually works. Most whiplashes get ignored, or the old way was to put one of those foam collars on to immobilize the neck, and they've realized that that's one of the worst things you can do. It causes all sorts of long-term issues. But sometimes it is nice to have a little bit of support when your neck is sore, but not to wear constantly for a week or two. Very soon on, a very gentle range of motion exercises are introduced. But one of the things that I find quite often is that people are forced to take their neck in a position it doesn't want to go. When the body is supported and allowed to go in the position it does want to go, it will start to release those tension patterns and begin to repair. So if you'd like to know more about this, please don't hesitate to call me. There's a button down below, or send me a message on this page, and I'll get back to you and we can have a chat about your symptoms and see what's going to work best for you. So basically the best thing that you can do is get some treatment as soon as possible. Within the first 24 hours is ideal, but that doesn't work for everybody. Most people don't realize that they've hurt their neck until some time later. But as soon as you realize that your neck and shoulders are stiff and sore after an accident, even a minor one, please go and seek some treatment, whether it be with myself doing orthobionomy, acupuncture, massage, physiotherapy, whoever it may be. But please seek some treatment, and if you're not happy with that, keep searching until you find a practitioner who can work with you and alleviate your symptoms and get you better. So I hope that's been helpful. If you know anyone who's suffering from an accident or injury where they've hit the floor, or been in an accelerator, deceleration, whiplash type situation, and they're having issues with their neck and shoulders, please recommend they go and see a recommended practitioner. So this is Vicki Tate from Body and Spine Aligned, and I'm based in Mansfield and Burpengary in Brisbane. But if you'd like to know some information, I'm very happy to chat with you on the phone or through Messenger. So please, I hope to talk with you soon. Bye for now.